life work you are complete. Good afternoon, everyone.
Hello, good afternoon.
Good afternoon.
Good afternoon.
Good afternoon, everyone, and thank you for joining us for our HSAC meeting. As you probably just saw in the chat, or if you may have seen in the chat, our HSAC chair, Angel Vic Lewis, is still taking a short leave. She's been dealing with some family emergencies, but she'll be back with us full-time in our November meeting. So she's here today, but she's told me she'd be in and out a little bit today. So she asked me, I've been asked to actually chair the meeting today. So I'm assuming that community development is Ruby, is that correct?
Yes, hello.
Hi, Miss Ruby. Great to see you today. And so I know you will let me know when we have a quorum because we do have a couple of items that are going to require a vote today. But as usual, we will start our meeting with the goals of the HSAC, which is to finish, finish the job of ending chronic homelessness, prevent and end veterans homelessness, prevent and end homelessness for families, youth, and
Madam
children.
Chair, we can't hear you.
Okay. I know Ruby was able to hear me. Is there anyone else that can't hear me?
I can hear you.
I can hear you, Helen.
Okay. Thank you.
Dr. Birch, can you hear her now?
Possibly not. Maybe having some technical difficulties with his speakers. That happens, especially in this day of going from meeting to meeting in different venues. A lot of times what speakers work on one venue ends up messing up your speakers for the next meeting. Quite possible. Maybe something like that happened. Anyway, the last goal is to set a path ending all types of homelessness. Sorry, I lost my train of thought. So the first item on or the second item on our agenda, first
How you doing?
to call to order and housekeeping. So I will remind you, if you're not speaking, to be sure to put yourself on mute, which it looks like all of you have. I appreciate that. The next item on the agenda are approving the minutes from August 25th, 2021 and September 15th, 2021. Do we have a quorum yet, Ms. Ruby? If not, we'll have to come back to that.
Possibly. Give me 1 second.
Okay. And I don't know if we have any public comments. Anyone has signed up for public comment today or not? I'm assuming no, since I wasn't told that there was someone.
No, no public comment.
Okay, thank you. Since Miss Ruby is trying to figure out about the quorum, we can just go ahead and move ahead to our next item and then come back to approving the minutes once she's confirmed that. So is Charita, are you ready to do the policy and planning quarterly report?
I can be ready. I'm just curious as to whether you guys can hear me, because I'm getting a note that something's going on with my audio quality as well.
I can hear you clearly.
Okay. Good evening. Well, good afternoon, everybody. I will say quick I'm on vacation. So I'm going to do the presentation, and I'm probably going to log off and come back and listen to this later. I'm trying to do better about making sure I keep my space for myself, and I need it. So this is going to be quick. So in the last 3 to 4 months, we did a lot of talking about some of the same things that have been on our HSAC agenda oftentimes. So we've worked on the shared housing, and we've worked on our state ESG funding, which is normal. And then a lot of work was done around our gaps analysis and our 500 block of Main Street, and trying to establish a prioritization for some units for our folks. And that's kind of been the gist of the last 4 months. Let's see, anything new? So I will definitely say in the September meeting, there was a motion to move forward on the 300 500 block request that was brought to HSAC, I think, in the September meeting, for us to move forward and refine a ask of the county as far as setting aside some units for people experiencing homelessness out of that new stock that is coming online soon. We are still moving forward our gaps analysis. The committee is working now on training for the staff to survey homeless residents here in Durham, to move forward on we've perfected the tool, and now we're doing some training around how we will aggregate that data and turn it into research findings. And stay tuned, forthcoming for requests from people on that committee as it relates to people potentially for interviews for our gaps analysis. The last thing, this past month or this current month, we spent a lot of time in the meeting. And this will come forward as a topic with HSAC. We will be sharing it with the executive committee about an education series, because it was a new group of liaisons coming to the group. We started our first new session of policy and planning with kind of brainstorming where we want to go, what concerns we have, how do we want to, from a policy and planning perspective, kind of how we want to go move forward in the coming year. And so from that discussion, we came up with the idea of an educational series, because we believe that it's very important for us to understand, one, the efforts that have already been made and the stumbling blocks that our community has experienced. So we understand why maybe a county, a city proposed project didn't go through, or a county proposed project didn't go through, or, anytime folks feel like our elected officials are not doing what they promised, sometimes there's a logical reason, and part of that is information that we don't understand, barriers we don't understand. And so we thought that it was very important for us to bring an education component to the table, one, so that we are more aware of the loopholes, two, so that we can figure out how to think outside the box and get what we need for our homeless residents. And the last part is, being creative in how we plan for the future. And so we even learned some new things in that discussion. And so that information will be coming forward to our executive committee, and then to into the bigger HSAC in the form of an education series around CDBG, ESG, something in our state called the Dillon Rule that impacts a lot of our plans or attempts at planning for housing in the entire state, as well as DHA policies or limitations of Durham Housing Authority and how that impacts our community. I think, unless Colin, Hanalea, or anyone else from policy and planning have anything else to add, I think that is the gist of our last 4 months. I will entertain any questions.
Yes, does anyone have any questions for Charita? They've definitely been very busy, as has performance management.
I would just add, just policy and planning, we want to do better. We want to move the needle forward. We've also talked about some pieces within HSAC that we feel like are missing, like an advocacy wing and what that would look like and how we would develop that. And it might require us to go back and look at our governance charter and interlocal agreements and things like that. So just stay tuned because things will be coming forward. We are ready to move this envelope. Our folks are getting left behind. Housing is getting more and more scarce. We have new people coming into our community and changing the game, and we don't have a lot of oversight. And most of the time we don't find out until it's too late. And so we feel an urgency from the policy and planning standpoint to make sure that we are well educated so that we can figure out how to create more housing for our homeless persons and move our goals of ending homelessness closer to reality.
Sharita, this is Tracy. I know there was someone who did a presentation on the gaps analysis. It may have been, I don't know if it was a consultant or graduate student from Duke University. Was that a preliminary piece of that, or was that the final gap analysis report?
So, and Colin, you can add to this if I mess it up. So that was the gaps analysis for that. We opted to use those students' research projects as the gaps analysis for 2020. This gaps analysis was supposed to be the one for 2021 that we had hoped to be able to present a few months ago, that has due to COVID kind of left us in a very challenging place, which is also why the students' research proposal was opted to use as the gaps analysis for 2020. So this is the report that was supposed to be due a few months back, like in August. We have pushed that timeline to December just because it's just been very difficult to do the meaningful work that we want to do with the gaps analysis in the timeline, taking the pandemic constraints into consideration.
Okay, so it was just looking as an overview of 2020. It's an annual gaps analysis.
So if I'm not mistaken, and Colin or Holland, feel free to jump in, that we are tasked with doing a small gaps analysis annually, and then every 3 to 5 years, we're supposed to do like a big system overhaul of looking at our system from a lot of different perspectives. And so we are trying to come in line with something we haven't really been doing in the past.
Okay, all right, thank you.
Does anyone else have any questions for Charita? Okay, thank you, Charita, for that. And please enjoy the rest of your vacation. Thank you so much for taking time out to come and give us a quarterly update today. We now have a quorum, so we will go back to our minutes review and approval. Everyone should have received the minutes in your email this week. Hopefully you've had a chance to look them over. So I want to ask first, does anyone have any questions or corrections to the August 25th minutes? All right. How about the September 15th minutes? Does anyone have any questions or corrections about those? Okay. Well, with that, I will accept a motion to accept the August 25th, 2021 minutes and September 15th, 2021 minutes.
Move approval of both sets of minutes.
I second.
Thank you. If you agree to approve these minutes, please respond by typing yes in the chat, nay if you do not approve, abstain if you need to abstain.
Madam Chair, who made the motion to approve and who seconded?
Was Drew, I believe, that motion to approve, and Charita seconded. I'll try to remember to say that out loud because I remember that from other meetings that it helps if the chair does that, and I forgot to do it today. I'll try to remember that. Okay, it looks like the minutes are approved. Great. We do not have anyone signed up for public comment today, so we will go ahead to item number 5, which is the collaborative application approval. The U.S. government in 24 CFR 578.9 requires continuum of care to approve the submission of applications in the response to a notice of funding availability or opportunity published by HUD to allow the COC board to partially fulfill this responsibility ahead of HUD's November 16th, 2021 deadline for submission of the COC consolidated application. The COC lead agency asked the HSAC to review and approve the current draft of the 2021 COC collaborative application. Who's going to be presenting about this?
Hi, Madam Chair, Lloyd Schweiler with the Department of Community Development. I'm prepared to make a brief presentation about the collaborative application.
Well, you have the floor.
Good afternoon, everyone. Hopefully, members of the HSAC and the COC have had a chance to review the collaborative application. I'll briefly review the sections of the collaborative application, and then we can perhaps have discussion prior to the HSAC's approval of the collaborative application. This year, HUD's collaborative application has 163 total points available, which is down from 200 last year. A lot of it concerns the information in section 1. And section 1, after one page identifying which COC we're talking about, there's a whole lot of information asked about coordination and engagement. And really, if you've had a chance to review the document, hopefully you have understand that the collaborative application really reports to HUD what we have done, as well as what we are doing and what our plans are going forward. So it's kind of like an annual action plan, or in some sense, really a community-wide performance report to HUD as well. So section 1B talks about coordination and engagement, especially with new applicants and new community partners. HUD is really interested in seeing that COCs are inviting new organizations to apply for continuum of care funding. 1C continues the theme of coordination and engagement, but looks at federal, state, local, private, and other organizations. A lot of information in section 1C about coordination and engagement around issues of domestic violence, how we're partnering with local education agencies or schools, how we're working with local public housing authorities, how we are working to ensure that street outreach covers the entire area of the continuum of care. Concerns about racial equity are some of the highlights in that section. A new section this year worth 20 points. Obviously, with the pandemic, HUD added a complete new section with about, I think, eight or nine questions specifically around our efforts to address the COVID pandemic, what we did to try to keep people experiencing homelessness safe, making vaccines available to them when they became available, etc. Section 1E looks at how we conduct the local competition for continuum of care funds, the project review and ranking, and that competitive process. Section 2 of the collaborative application moves into data. A brief section 2A is about the HMIS implementation, how well we're doing, what kind of bed coverage rates we have for beds that are dedicated to people experiencing homelessness in the community. New questions in there. In that section also ask about how well victim service providers provide data from comparable databases to the continuum of care about people who are survivors of domestic violence or infant partner violence, and are they cooperating with the COC? Also, 2B goes into our point in time count report, and 2C continues that with looking at system performance on HUD's 7 key system performance metrics and what we're doing in that regard. Section 3 of the collaborative application does not largely concern Durham this year, insofar as we don't have a project that's applying for coordinated housing and healthcare bonus points, nor do our new projects plan to use COC funds for acquisition or construction, which is what section 3B is about. Section 3C concerns serving persons experiencing homelessness as defined by other federal statutes, for example, using COC funds to serve youth who would meet a different definition than HUD's definition of homelessness. And also, we don't have those kind of projects. Section 4 moves into specifically focusing on our domestic violence bonus project this year. And there are several questions in that section that we're still working to get completed in collaboration with the LGBTQ Center, which is being recommended for the domestic violence bonus project. And then section 4B has a number of attachments, several that are required. Some of those attachments, for example, public posting of the various project applications, as well as our completed collaborative application and priority listings, et cetera, really cannot be uploaded to the collaborative application until later in the process, when we've obtained approval from the COC board for these and for the application. So that is a brief overview of the collaborative application itself. If there are particular questions or comments about any particular section, I can certainly share my screen and bring up particular sections so that everyone has the same information if there are questions about a particular topic. Madam Chair.
Thank you, Lloyd, for that. Does anyone have any questions for Lloyd? I know this information was included in the packet for this meeting, along with the agenda and everything. Hopefully you have that. Any questions for Lloyd about any part of this? So my understanding, and please correct me if I'm wrong, is that this requires an HSAC vote to approve the submission of applications that we've received. Is that correct?
Yes, that is correct, Madam Chair. The consolidated application really requires approval of 3 components, the collaborative application being 1, the priority rankings being the 2nd, and the actual project applications themselves being the 3rd. Project applications have been reviewed by department staff and have been, we've made recommendations to them. Though all of the project applications, including the 1 project that is not going to be, that is not currently being recommended for funding, will be posted to the COC website in the days leading up to our final submission to HUD.
So everyone is clear what we're going to be voting on when we need to accept a motion in a second. So we need a motion. To approve the submission of applications. Collaborative application.
Motion to approve.
That's Chris Tonis.
This is Jonathan Crooms. I second that a motion to approve.
Thank you, Jonathan. We have a motion and a second. So if you approve, please type yes in the chat. Nay or no if you do not approve, or abstain if you need to abstain. Thank you, Ryan. Saw your extension.
Thank you, Madam Chair.
And Dr. Birch is abstaining as well. Okay. Looks like we have yeses for everyone else. So the motion and one no.
I said no because I haven't read it.
That's, do we have a, I guess. So we have quorum, we have enough yeses from that to be able to pass it. Is that, if I'm understanding that correctly?
Absolutely.
All right, thank you. Well, then the motion has passed. But thank you, Lloyd, for your presentation and everyone for your votes. We will move on to the next item on the agenda, which is a priority ranking approval for COC funding. Jonathan Crooms, who is the chair of the Performance Management Committee, will be talking to us about HUD's requirement of COCs to recommend projects for funding in rank order from the highest priority project to the lowest priority. The scoring committee, formed by the Performance Management Committee, scored 3 new project applications and reviewed the scores and rankings of 9 projects seeking COC renewal funding. The Performance Management Committee reviewed the proposed rankings prior to forwarding them to the HSAC for final approval. And that information is also in the packet that you received from with the agenda. So Jonathan, the floor is yours.
Madam Chair, would you like me to proceed now? Because I do see there, I believe somebody had a question, and I didn't know if that was in regard to the previous matter or. Well, it looks like the question has gone away. All right. Well, good afternoon, everyone. I'm Jonathan Crooms. I'm with Durham County Veterans Services and the current chair of the Performance Management Subcommittee. The Performance Management Subcommittee has been hard at work scoring the projects for this year's COC funding competition. This is what the memo looks like if you all want to pull it out and follow along. One pager in the middle. HUD is allowing the Durham Continuum of Care to apply for up to $1,751,369. And the way that breaks down is that $1,385,194 of those dollars are for what's called the annual renewal demand, basically for all the projects that have been current or prior recipients and are renewing their project funding. There is also a permanent housing bonus worth $91,544 and a domestic violence bonus project worth $274,631. If you look at the table here, the way that you read this is certainly the leftmost column is the rank of each project. The next column over is the name of the organization that has the project. The preceding column is then the project name, and then the type of project, whether it's HMIS, permanent supportive housing, or rapid rehousing. The way that these are scored, there's 2 ways. One is that we have 2 different tiers. We have tier 1, which is includes all renewal projects and any project that is deemed absolutely essential to the operation of the COC. And then in tier 2, we have all new projects. So it's scored by tier, and then within the tier, it's scored by the highest percentage score. So the 9 renewal projects were evaluated by Lloyd Schmeidler and Colin Davis. Basically what happens there is, because it's a renewal project, all the data from HMIS is pulled out, inserted into the scorecard, and that's how you get the percentage score. The scoring committee was made up of myself, Rita McDaniel, Helen Mangum, and Shana Kerrigan. We scored the 3 new project applications. And what we had was two new projects for the permanent housing bonus and one for the domestic violence bonus. And so what the scoring committee is ultimately recommending is that Streets to Home 3 be recommended for the permanent housing bonus, and the LGBTQ Center's domestic violence bonus project be recommended for the domestic violence bonus. We also did not recommend the LGBTQ permanent housing bonus for that project. We can only recommend one of those projects. And while it scored well, Housing for New Hope's project scored a little bit higher, which is why we recommended it. Some takeaways from the scoring, all the projects are above 70%. If you all may remember that 70% is the base score. Anything below 70% is a failing grade. Anything above 70% is a passing grade. And the scores were definitely up this fall as compared to last spring. We did have two projects that were slightly under the 70% mark last spring. Both of them are now above it. So we have seen overall some improvement in scores, which is very promising. So with that being said, I'm going to stop there and we'll turn it over for any questions that folks may have for me.
Thank you, Jonathan, for that. Are there any questions for Jonathan before we go to vote?
Madam Chair, if I might offer one minor additional point to Jonathan's comments. So again, is Lloyd Schmeidler. In terms of the scoring of the permanent housing renewal projects, we did carry over the score for the Housing First implementation from the spring 2021 scoring that was done by a committee of the Performance Management Committee. So that was one component, one of the 5 that was carried over to the scoring that Colin and I did not do, but that was done by the committee. Thank you.
Thank you, Lloyd. Drew, did you have a question?
Yes, thank you. One is just sort of an administrative observance on the sheet that has all the numbers on it, which is page 66 of the PDF, at least on mine, which would be, I think it would be helpful for me to see what they, if it's unclear to me, so that there's the total request, is that what they requested? Are in all cases, is that what they are being awarded? I feel like there might be sort of a missing column or two here that would make this a clearer chart to read, for me anyway. And the second thing I wanted to quickly observe is sort of my annual observation. And I know that there are some reasons lurking behind this that you know may make some kind of sense, but that again, we sort of go through a long scoring process, and then in many cases our funding sort of decision making or awarding doesn't seem to sort of, the scoring doesn't really seem to have much bearing on how we award funds. And so, for example, a brand new person looking at this might ask, why aren't you pushing more funding towards your higher performing projects? You know, and it could be that it's important. I mean, I'm sure it is important to keep the other ones going. But on the other hand, if they get what they ask for, regardless of their score, what are the incentives to improve, right? Or to change, you know, whatever it is that's causing them to get a lower score. So I don't know. I'm not even really, unless somebody wants to respond for the benefit of the whole group, I'll just kind of put that out there for consideration. To me, those are kind of aspects of this annual process that don't, you know, always totally make sense to me. But that a lot of work has gone into reviewing the proposals, that all of these projects are important parts of our homeless continuum, and that we wouldn't want to see any of them go away. But it's in all of our interest for all of them to, you know, to be scoring an A or a B plus, right? Or possible, sorry, dog is getting, I'll leave it there and put myself on mute.
Lloyd, do you want to take this, or would you like me to start and you can fill
I
in.
could take it if, I was thinking the performance management chair might want to chime in, but I'm happy to respond. Jonathan? Shall
Yeah,
I chime in?
I will be happy to chime in, but I would love for you to go ahead and maybe address sort of the technical aspect of that.
Sure. Yeah, so this is a challenge. HUD actually wants COCs to consider what the overall needs of the COC are, as well as look at the performance, evaluate the performance of its COC funded projects and consider reallocating low performing projects to higher performing projects, or to award funds to new projects that would have an opportunity, hopefully, to be of greater assistance. The challenge with the renewing projects is that if funds are taken away from them at the end of their COC funding, then we as a COC and community have to figure out how we're going to continue to provide many times supportive housing opportunities for the people enrolled in the project, or transfer them to other funding. Certainly with permanent supportive housing projects, that would be an important consideration. HUD actually, I think we're going to lose some points this year on our collaborative application for not having what's called reallocated up to 20% of our 2016 COC amount to new projects. We reallocated. People who've been around the COC for several years will know that we reallocated completely away from transitional housing over, I think, $500,000 to $700,000 worth of funds that we had in transitional housing. We reallocated those in the 2012 to 2016 time period generally to rapid rehousing. So we are being encouraged to look at reallocating, try to make decisions around reallocation in the spring of the year, in the spring evaluation, so that, for example, so that projects are not surprised when it comes to the COC competition that their funds are being reallocated. But there are opportunities for the COC board to look at the scoring and the performance of all of the renewal projects, and to make decisions about reallocating some or all of those funds. From our point of view at the lead agency, because we have a limited number of organizations implementing COC projects, we want to try to do that if we can. Sometimes we can't, but we try to do it in consultation and in agreement with the organizations using these funds, rather than having it simply be a COC decision that the organizations are opposed to. Colin or Jonathan, you want to add anything to that?
Yes, so we do have a policy in place that, as of now, the way that we would look at reallocation is if we had a project that scored under the 70% passing mark and a performance improvement plan was not helpful, or was not able to rectify whatever deficiencies, then we could certainly look at reallocating. But there is a little bit of a process there, and the way that that's set up is to try to give those projects as much opportunity as possible to to have their performance improve. So it is possible, but again, because everybody scored above 70%, thankfully we don't have to have that conversation at this point.
Thank you for that. Are there any other questions or comments? Okay. Well, this requires a vote from HSAC members. So At this point, I will accept a motion to approve the rankings as presented by the Performance Management Committee.
Have motion to approve the minutes.
Angel
This is
Vickler,
Anita. Yes.
do we have a second?
I'll second
Good
that.
afternoon.
Mayor Shul, I have your second. So we will vote yes if you approve, no if you do not approve, or abstain if you need to abstain in the chat.
Motion carries, Madam Chair. You have two abstentions, but more yeses.
Yes, thank you, Dr. Birch. So the motion carries. It's always good to have an extra set of eyes on that chat when we're trying to figure all that out. Thank you. So that motion is carried, and we will move along into the next portion of our meeting, which is the coordinated entry annual evaluation. The Durham Continuum of Care is required by HUD to conduct an annual evaluation of its coordinated entry process. This report serves as the annual evaluation for the 2021 fiscal year, which ran from July 1st, 2020 to June 30th, 2021. This report evaluates coordinated entry implementation and performance during that period and attempts to contextualize it by comparing it to previous year's performance data. The report also provides an overview of the evaluation and planning process conducted during this period to develop a new housing prioritization process, which is now being piloted by the COC. Who will be presenting this?
Madam Chair, good afternoon. This will be me, Hanalea Hoberman, staff with the City of Durham and Coordinated Entry Administrator.
You have the floor.
So, good afternoon, everyone. I am excited to come to y'all with my evaluation for the first year in which the city has been doing the coordinated entry role in-house. We brought this role back in-house in September of 2020, so almost the entire fiscal year. So this is our evaluation on behalf of the COC. And those of you who got a chance to look at what was included in your packet, it's a very comprehensive evaluation. And really, I'm here just to touch on what I think are the key takeaways and key data points. But I invite everyone, if you haven't yet had a chance, to read the full report to get a better sense of what was done in that evaluation and what was found. So the first point that I want to touch on is what we saw in terms of coordinated entry intakes during the past year. So there were 2,221 coordinated entry intakes completed during the 2020-2021 fiscal year. For those who aren't familiar with what I mean when I say coordinated entry intakes, this is how people enter the system. So this is people who are at that first touch point saying, I'm experiencing a housing crisis, I'm homeless, I need help. So this really is where we get our sense of how many people are experiencing homelessness and seeking homeless services in Durham. So this is a 5% increase in intakes over the previous fiscal year, but a 17% increase in household serves. So what does that mean? That means that while we saw a small increase in actual people experiencing homelessness, we saw a large increase in people experiencing homelessness, what we saw was fewer people coming back over and over again. So we were serving more people, but we were serving them fewer times. And that's a good thing. We want to be able to help people the first time they come through, not have them come through our system over and over again. So this raises two important questions. The first is, why were we seeing more people? And the second one is, why were there fewer repeat intakes? And I apologize, I realize the way I have presentation on, I can't see my notes. So just give me 1 second to change the viewing so I can see my notes.
They will
know
be
if we-
getting-
if we have any PowerPoint whizzes here, but the only way I can think to do it is like this. Does anyone else know how I can share larger but still see my notes? Because I've got data points in here that I think I can do presenter view.
There's a question in the chat for you, Hanalea. It says, are these people starting from the beginning to get housing?
So these are people coming to us experiencing a housing crisis. They could be looking for shelter, they could be looking for help with housing, but they are at the beginning of seeking services for their housing crisis. And I apologize, I just cannot figure out presenter view where it lets you see your notes. So I'm gonna have to continue like this. Can everyone see it if it's this big? I'm sorry. Anyone can chime in and tell me. Oh, I can do it. All right, I'm gonna keep going. So basically the summary here is it's too soon to know whether the increase in people served is a temporary increase due to COVID-19 of real people experiencing homelessness, whether we're just reaching more people or whether there's something else going on. Maybe this will be a long-term trend that actually there are more people experiencing homelessness in Durham. So we're really going to need to keep an eye on these numbers as time goes on to be able to determine, what we're seeing. The reduction in repeat intakes, though, I want to take a second to highlight some possibilities there. So we did a lot in the past year to increase our access to clients, increase our ability to track them. We brought on a new project for comprehensive street outreach services. We brought on several coordinated entry hubs that help us to access the hardest to serve clients. And we also had a big change in that we had some non-congregate shelter brought on as a result of the COVID-19 pandemic. And for just a second, I want to highlight these numbers because I think they're pretty profound. So, because of COVID-19, we had to bring on non-congregate shelter at the Carolina Duke Hotel to serve medically vulnerable clients who could not be in congregate shelter due to their risk for COVID-19. What we see here is some really interesting data around the impact that this may have had on clients coming through the system over and over again. So, while 64% of congregate shelter clients who left shelter in 2020 stayed less than 30 days, those really short-term stays we see a lot in congregate shelter because of the difficulty of staying in congregate shelter, only 19% who left the hotel stayed less than 30 days. And it's not that people were staying in the congregate shelter for 30 days and then becoming housed, because actually what we see is that the rate of permanent housing exit from the non-congregate hotel was much higher than the rate of permanent housing exit from the congregate shelter. So not only were people able to stay in place, when they stayed, we were able to get them housed. So 19% of those who left congregate shelter left to permanent housing, but 34% of those who left the non-congregate hotel left to permanent housing. So as time goes on and we see this data develop and we may go back to a situation where we only have congregate shelter, we'll have to see how this has an impact. But I just think it's important for the community to know and think on the fact that having this non-congregate shelter option appears to help our most vulnerable clients stay in place to get the help that they need. And that may have been a big part of why we saw a reduction in repeat intakes. Any questions on this? All right. This is where I need my notes.
Yes, I'm sorry. I do have a question. So are you saying that it was, so that seemed very important. Is it that the people in the non-congregate hotel are having a more, I don't know how to say it, a better experience there than in the congregate shelter? They're therefore willing to stay longer, and that gives us a better chance to help them get housing? Or what's the, help me understand what that means.
I mean, I would welcome our providers to chime in here. I can only speak to what I see from the coordinated entry administrator side. And what I can say is that a lot of the challenges of staying in a congregate shelter, curfews, conflicts with other residents, just a discomfort with the chaos of the setting, that cause people to go in and out a lot. Either they miss curfew and so they're back out on the waiting list, or they had an altercation with another resident, or maybe they just didn't like it, they couldn't take it anymore. Those really are reduced in that non-congregate shelter setting. So when someone goes into that non-congregate shelter, we see less frequency of those kind of what we call those negative exits, where people are just exiting back out onto the street or back out into a temporary situation. So it's, it's not that everyone got housed right away. By no means is that the story here, but I do think that it is important to note that it does appear that for highly vulnerable clients, a non-congregate setting appears to allow them to stay in place longer to get the help that they need. Any other questions on this?
That was very helpful. Thank you.
Absolutely. All right.
I'm glad this is Drew. I've had to go off camera, but I wonder, the clients who are at the Carolina Duke Inn are sort of qualitatively different, right? They're higher need, but we also have a lot of additional kind of service providers out there. We have Project Access and Reinvestment Partners and Urban Ministry staff, kind of not all working on all of the clients, right? But sort of there's a kind of a different and perhaps somewhat deeper group of folks working on trying to figure out permanent housing exits there. So it's possible, they're not the same kind of client exactly, and the services available out there are also a little different than are available sort of at Urban Ministries proper and other shelters. So there might be multiple reasons why the outcomes would be a little different.
Sure, Drew, I think that's reasonable. I will point out a few caveats to that, though. Although they are more medically vulnerable, there are a lot of vulnerabilities that would not qualify a client for CDI that would qualify them as vulnerable in our system, such as severe mental health issues, substance abuse, the kinds of disabilities that tend to cause clients a lot of trouble in getting and maintaining housing actually don't qualify for CDI. I think it would be very interesting, to your point, to do an analysis of the priority level of clients in the two shelters, and that's really where you could get, are they being prioritized higher in our system, right? And that could get to the permanent housing exits, but I don't think it really gets to those short-term stays that we see very commonly. In terms of the question about different types of providers, I'd welcome others to weigh in. At least from my perspective, we see, the same case managers on either side. And in here, I'm analyzing specifically only the UMD, shelter, not CDI, because I wanted an equivalency of services. So I do think, I don't know if there are additional services being provided there that I'm not aware of. I think it's a valuable question, but at least from my perspective, it doesn't appear that the services are so different. All right.
So can I ask another question?
Yeah.
So I guess I'm thinking, we've been talking a lot about trying to get a non-congregate hotel for permanently. And one of the things I'm listening for, and I'm not asking for more answer about this, but just seems to bear more thought, which is it the structure, is it the fact that it's non-congregate, or is it the fact that there are more and different services being offered? And so I'm hearing a discussion about that, which seems important. And it would be great for those of you all who are doing this to, help us figure it out, because I do think this is a really interesting, I think, super, not just interesting, but super important result. And so to figure out exactly what makes it happen seems just essential. That's all. Thank you.
Absolutely. I think this is my hope, and I will say my hope with this entire report is to bring more discussion and more inquiry into these topics. I offer possibilities here, but no answers. And so I hope that all of this will be food for thought and opportunities for the HSAC to really pick up some of these topics of interest and discuss more about what they mean and what they could mean for our priorities.
Can you in the chat Rita McDaniel asked, can you explain what the difference in the two housing situation?
Yeah, so very briefly, and I'm going to say this is the last question I'll take on this slide, not because they're not all valuable, because I'm aware of time, is that in a congregate shelter setting, you know, multiple unrelated people are staying in one space together. You have a more traditional setting where you have to be in by a certain curfew, things like that. In a hotel setting, you have your own room, and the only other person in that room is going to be someone that is your partner or someone that's related to you. And so there's more of that private space element. That's the biggest difference when we talk about congregate versus the non-congregate space. And again, I'm just gonna, I'm gonna move on from this. Please welcome additional conversations and questions, but I'm just very aware that that I want to make sure we get to more of this for y'all. All right, so the second major finding of the report relates to our performance as a community on shelter diversion. So what is shelter diversion? Shelter diversion is basically prevention at the point of crisis. So we're at the point where that person is saying, I need shelter, I'm about to enter shelter, help me. And we work to find an alternative solution for them that gets them out of homelessness and prevents them from entering the homeless system. And the core point here is that we are both improving on improvements in our system quarter over quarter and year over year, and that we are outperforming national standards. So the diversion rates were already very good in the first year of implementation of the program, but they've gotten even better in the past year. And I am going to reduce the size just so I can see my exact data points for y'all here. So in the past year, 29% of intakes resulted in diversion overall. 44% of families who sought services were diverted, and 22% of singles were diverted. And this far exceeds national standards. So our expectations nationally are that 30% of families and 15% of singles will be diverted. And overall, this is a 6% increase in successful diversion rate from the previous year. So we're really excited to see this, just phenomenal performance, and really hopeful that this will be sustained. There is, of course, the possibility that some eviction moratorium effects are seen here in our ability to keep clients housed. And now that the eviction moratorium is transitioning out, you know, the next few quarters will tell us whether these improvements will be sustained or not. All right, so the next couple slides deal with the vulnerability of clients seeking shelter and going into shelter. So when we set up our new front door system, we had a big goal, which was to prevent clients who didn't need to enter shelter from entering, which is the piece that is a diversion part. And then the other big piece is to ensure that the most vulnerable clients in the system got shelter first. And the way that we're measuring vulnerability here is two ways. One is, were they unsheltered before they entered shelter? In other words, they weren't in housing. They were on the street, they were in their car, some literal homeless situation. And two, what is the percent of people that have disabilities when they enter shelter? And in both points, this has been a very good year for our performance here. And it was really borne out the goals of the program. So this is the kind of trend we like to see, particularly on the single side. As you see, we saw increases in our first year of implementation in 1920, but the increases have just grown over the past year. The family story has been a bit more complex, but it's still positive. So the percent of unsheltered singles that were unsheltered before they entered shelter rose by 8% in the first year of entry points implementation. That was 1920, but by another 7% in the past year. So that's a 15% increase overall. So we don't know yet whether we plateaued. It may be that these increases continue. It may be that they're temporary as a result of COVID. But my analysis shows that I believe that at least a portion of the 2021 improvements are sustained improvements that we will continue to see after the end of the COVID effects. Of course, that will yet to be seen, but that is what I believe from the data. The percent of unsheltered families increased during this time period by 4%. So again, a smaller increase. This is partially expected because families already had a diversion program before we implemented the new system. But it's good to see that there is some increase happening, particularly over the past year. make this large for y'all for a second. So then the second way that we measure this is the percent of adults entering shelter who have disabilities. And again, the data is very positive on the single side and is somewhat positive on the family side. So the percent of adults with disabilities didn't increase in the first year of the program, which led us to ask questions like, maybe our prioritization isn't working. Maybe we haven't achieved our goal of serving more vulnerable clients. But in this past year, we started to see those improvements happening. So in the past year, we saw the percentage of adults entering shelter with disabilities rose by 15%. With families, the story is a little bit more complicated because it actually dropped by 6% in the first year of implementation, which was of course concerning, and it just rebounded to its pre-implementation levels. So we saw improvements over both sides, but with singles, it was real improvement, and with families, it was a return to normalcy. Again, yet to be seen whether these are temporary improvements or permanent improvements. We can't discount that we have specifically right now a non-congregate shelter for people with medical vulnerabilities. However, when I did all of the analysis and pulled out the effects in the non-congregate shelter, I believe these effects at least partially will be sustained and that we're seeing real improvements in our ability to serve vulnerable clients in shelter, but we'll see if that data bears out. So I want to pause here and just stop for any questions about our diversion performance or our services for vulnerable clients in shelter. All right. So the next series of findings deal with our big goal in the homeless system, which is to get people housed. So what we want to see once people have entered the homeless system, whether that's through street outreach or whether that's in shelter, is we want to see them exiting that program to permanent housing. And here, this is, and I stated in the report, I will state it again here, this is the most concerning finding in the report. Over the past 3 years, our exits to permanent housing have dropped year over year. The largest drop was from 1819 to 1920, so 3 years ago to 2 years. But we did continue to see a drop in this past year. The drop for families was larger than the drop for singles, but we saw it over families and singles. So in terms of the numbers, the percent of clients that were served in shelter and street outreach that exited to permanent housing dropped by 12 percentage points in the 1920 fiscal year from the previous year. And then they dropped by another 3 percentage points in the past year. So you can see there's a slowing of the trend, and we hope a stabilizing and then a reversing of it. But at the moment, we don't know yet if we have yet done enough to reverse the trend. And only time will really tell. We're happy to see the trend slowing, but I think it's really important that the community keep its eye on these numbers. And in working to understand this trend, it's important to look specifically at our rapid rehousing rates. Rapid rehousing is the major engine by which we try to house people in the system. We have the most spots in it. We got a lot of funding through COVID money to expand our rapid rehousing implementation. And so the story is kind of mixed here. So we saw a big drop in the second quarter of 2021 in rapid rehousing placements, as we essentially, I've described it before as turning the ship. We had a major shift in how we were prioritizing clients, how we were doing the system. And so as we tried to turn the ship, kind of everything ground to a halt. And then this past year has been a slow return to pre-COVID levels. So only in this first quarter of 21-22 did we finally return to those pre-COVID levels of rapid rehousing placements. So that's a good thing. However, it's concerning when you consider how much more funding is in the system right now than was there before. We greatly expanded funding for rapid rehousing, and yet we're only housing as many people as we were through these programs as we were before COVID. So hopefully if this trend continues and goes up and up and up, that's a great thing, and we'll be really happy to see that. If this stables off at this level, I think there will be some important questions to ask. So I want to just go a little bit more in depth into some potential explanations for the ongoing decline in our permanent exits. And again, I think there's a lot of rich conversation that can be had here. These are just some potential thoughts. So the first one is that as we improved our diversion And as we prioritize shelter for more vulnerable clients, we were serving clients that were harder to house. And so it would be expected that fewer of them would self-resolve, and therefore they would stay in the system waiting for assistance. In 1920, DHA put a hold on accepting housing choice voucher referrals, and that, you know, shut the door for a major pathway to housing. And even though they reopened the referrals in September of 2020, it never really fully returned to what it was before because of the pandemic. It's taking longer to process applications. Also, it's taking a lot longer for us to find housing for people. And that really goes into this next point, which is the effects of the pandemic and the eviction moratorium on the housing market have led to a longer housing search process. We're across the board having a hard time finding housing for clients. As we know, the housing we do find is less affordable. It's been much harder to find those units. Some additional potential factors here are that, you know, as the COC has turned to focusing our housing resources on those that are most vulnerable instead of those that are easier to house, it makes sense that it's going to take longer for us to serve them, and they may need more services, which means that each service might be more expensive. Rapid rehousing providers previously primarily served families, with the exception of COC Fresh Start, which you talked about when you talked about funding today. And the rest of the rapid rehousing providers had to adapt to housing singles, and that took time. And then finally, just the general pressures and challenges of the COVID-19 pandemic interrupted the housing process in a lot of ways. And that could have had a factor in our ability to house people. So I just want to pause here for any questions or other thoughts about this concerning trend that we're seeing, what we have on the horizon, and anything else related to housing exits in the COC. All right, Helen, how am I doing on time? Just want to make sure I'm keeping it.
We have maybe 2 minutes left.
I was hoping to go into a description for y'all of our new housing prioritization process and the ways in which we're now assessing clients. We've moved away from the VI SPDAT. It's described in detail in the report. I hope everyone will read it. I will also send this out. I'm sorry that we weren't able to get to it, but I don't want to dive into a whole other topic when we really don't have time to go into it. So I might stop here with just the past evaluation, and you know, maybe I can come back another meeting, or for those who are interested, I definitely recommend reading about what we're doing. We're really excited. I'll just say briefly, just, you know, maybe I can take 1 minute to explain why we moved away from it. So for a number of years now, we've been using a prioritization tool called the VI SPDAT, which is flawed in many ways. It has very poor inter rater reliability, meaning we get vastly different scores depending on who's scoring. We have a very hard time accurately measuring vulnerable clients. There has been national data, and we also found locally that the data was racially biased in this tool against Black and African American clients. And there has been research put out there at this point that the tool doesn't predict housing outcomes. So the Policy and Planning Committee appointed a subcommittee that worked with me over spring and summer to develop a new evidence-based strategy that addressed the issues with the VI SPDAT and address local priorities. It's detailed in the report if you're interested. And we're now piloting it. We'll be piloting it through March of 2022, and then taking back evidence findings, including racial equity, to policy and planning to hopefully formalize the new process.
Thank you, Hanalea, for that presentation. Very good information. I would invite everyone to read the information that you got in your agenda packet, as well as if you have any additional questions, feel free to email Hanalea or Charita, who's the chair of the Policy and Planning Committee, and they'll be glad to respond. As Hanalea says, we could probably bring another presentation to finish up what you didn't get a chance to get to today at one of our future meetings. But thank you again. We will move to our next agenda item, which is the home ARP update. And who will be talking about that? Colin.
That'll be me. Thank you. This will be very brief unless there's a lot of questions. We had planned to bring forth some proposals of what we could do with the $4.3 million of home ARP funds to the HSAC in November. When we had outlined that time frame, we were operating under what we had been experiencing from HUD with all of their other COVID-related funding, which was, here's a ton of money, tell us tomorrow what you're going to do with it, and it has to all be spent in 5 minutes. So we were trying to get ahead of the curve, and by getting ahead of the curve, we got thrown a curveball by HUD when they told us that in order to access the $4.3 million, a substantial amount of work needs to be done at the local level, not just listening sessions and input from HSAC, but also with approximately 8 other specifically identified groups, and a gaps analysis, needs assessment. And for those who are familiar with it, it's essentially the same that we do for a 5-year consolidated plan for HUD. We're just doing a miniature version of it. So it's a lot more work than we could actually do in a 6-week time period. And it's enough work that HUD is sort of laid this out in a 100-page document of what needs to be done and all the check boxes that need to happen. So we are working on a new timeline, and as a department, as to what this may look like, to coordinate with city and county leadership. And we will keep the HSAC abreast of the timeline and progress once that gets flushed out. I just wanted to keep everybody in the loop of it, because I know there was a lot of excitement about doing this, and there still is. Unfortunately, we've got to stay in compliance with the rules and regulations. Otherwise, any work we do now will get thrown out the window and have to be repeated. And I don't know that any of us have capacity to do the work twice at this point. So with that, I'll take any questions. If not, we can move on to the next item.
Questions for Colin? Okay. Thank you for that information, Colin. Our next item is the COC liaison announcements. And per the governor's charter, COC liaisons for the policy and planning and performance management committees were appointed by the HSAC executive committees. That's just information only. You know, I don't know if you have any questions about that, feel free to ask, and I will defer to someone who has the answers. Thank you. Then our next item is white flag planning. Colin.
This I am going to defer to Open Table Ministry, and Carolyn Schultz is the executive director of Open Table, and her new assistant director, Drew Wotan, I believe will be giving us an update on white flag planning for this year. So with that, I will turn it over to Drew and Carolyn if needed.
Thanks, Colin. Good afternoon, everybody. Like you said, my name is Drew Wotan, and I am still relatively new to Open Table Ministry, but it's a great place to be. And I'm so glad to be here this afternoon to share a little bit about, with you all about our plans for our white flag for our emergency shelter that we will be doing this coming year. Through our ESG COVID funds. So just going to provide you with some broad kind of framework for what we will be doing and some information about our planning moving forward. So we will be planning on offering our short-term emergency shelter at Trinity starting early in 2022, as soon as it gets cold enough for white flag evening, and we will do that for 90 days after that first cold weather night. For those who are medically vulnerable, for families with children, for those with mobility issues, we will be reserving up to 15 rooms at CDI for those white flag nights only. And those will not just be on a nightly basis, but those will be for a chunk of times when it's going to be during below 32 degrees. With our ESG COVID funding, we can do nights earlier. than 2022. So if it's mid-December or even earlier than that, we can have a few rooms. We won't be reserving those too far ahead of time, but we'll be coordinating with CDI to let them know that we will be standing it up. And when we know that temperatures are going to be dropping, we'll give them 48-hour notice to set up those rooms at CDI. So this is just a very rough plan. We'll be setting up detailed meetings with other service providers and kind of key stakeholders within the coming weeks as we work to just finalize our workflows and policies and procedures as well. So I think that's all I had to share. I don't know if Carolyn or Colin, if you all would like to fill in anything else as well.
Thank you, Drew, for that. That's very good information, and we look forward to the process being implemented. It's always great to have a place to send people. And I know EMS, they're always asking me every year, what do we do when it's cold? Where do we tell people to go? So it's great to have the information and know what to tell them when they do that. Any questions for Drew? Go ahead, Carolyn.
Let me just add that I'm really grateful for the opportunity for us to do it again, and the work entrusted to us as a result of what we did last year. And the EMS folks just were fabulous. Not only did they bring us people, but we had to call them multiple times for people that were too ill to stay. And it was a great partnership with them.
Thank you. I'm always glad to hear nice things about my EMS folks. Any questions for Drew or Carolyn or Colin about White Flag? Okay.
I have a question.
Go ahead, Rita.
I know this is for at night, but what about the days when it's still below 32? Do the people get to stay in those shelters on those days that it's 32 and below outside, or do they still have to leave during the day?
That's something we're still discussing. The people that are medically vulnerable and staying in hotel rooms, we're in a much better position to allow them to stay for a more extended time. In other words, if we've got a week of really cold weather, we'll check them in at the beginning of the week and check them out at the end when it warms up. The folks that are staying in the basement of the church, we don't have staffing to be able to keep them 24 hours a day. We just don't. So checkout is about the time it's starting to get light. They need to be out by 8 was the way we did it last year. If folks have suggestions as to how we might have a place for them to go during the day, as far as I know, we don't have a day shelter in our community as yet. That's a dream of mine, but not yet.
Let me ask Carolyn, Madam Chair, what happened with Dr. Davis over at Nehemiah? Did they close down?
I'm not certain. It's my understanding that during COVID it did discontinue.
Okay. Has anyone been back in touch with him? Is Drew still on?
I believe it was also supposed to be temporary while the library was closed. That was why it was opened. And since the library opened, the county suspended their funding.
So is there something that we could do because I can get in touch with Dr. Davis, because if it's cold outside, folk have to have somewhere to go. I mean, I was in Philly and the temperature dropped and seeing people playing on the concrete, one guy laying in front of a bank is real for these folk. And so what can we do that they can have somewhere to go during the day?
I have something to say also. Wasn't there a discussion about the homeless people hanging around in the library before they remodeled it? So I think if there was a possibility to get funding back to Nehemiah for like a day place for them to hang at on the cold days, it would be greatly appreciated. But other than that,
And I'd be more than happy to speak with Dr. Davis. And I know that during the time we were looking for a place, I also reached out to Elder Blake of Fisher Memorial, as well as Dr. Washington at Mount Vernon, and they were both willing. So, I mean, if that's a conversation, Madam Chair, you think we can have whoever I need to get in touch with, I can talk with those pastors and see what we can do.
Thank you, Dr. Birch. Colin, I see you had unmuted. Do you have some comments?
I was going to say that's a really good point. I'll follow up with Drew on Nehemiah. I know Sheldon is on here from Urban Ministries, and last winter when we had some of the really bad cold snaps and nasty days out there, Urban Ministries did open up their cafe for maybe not all day, but at least became a warming center for some number of hours during the day with social distancing in place. And Sheldon, I don't know if that's something Urban Ministries would be willing to do again this year.
So, Colin, I mean, I think that could be an option. I know typically at this point, we've been trying to, reserve our spaces for the residents that we have, which trying to keep limited numbers oftentimes kind of gets you to those thresholds. But I think when there would be more extreme situations, we'd be able to assist, to allow some community folks to participate in that.
We'll take a look at it, see what kind of options we can come up with. And as we work through possibilities, or if there aren't any possibilities, we'll bring that back and keep the HSAC abreast of those discussions.
And as Drew stated, when he gave his report, this is a broad brush. This is to give you an idea of what we're planning, and we are still planning. So it may be that we can plan in some time for people to remain in the place that they sleep, but we would have to make arrangements to budget funding for the folks that are going to watch over them. We don't have full-time staff for that sort of thing.
Do you have a question? Yeah, you had your hand up. Right?
Oh, sorry. Yeah. My understanding is that, when I visited Nehemiah, they basically had a security guard at the door and, a table with flyers, and then, like maybe 4 or 5 desktop computers set up so that people could have access to the computers. And that was specifically because when the library was closed for renovations, that was a service that people were using and were not able to utilize. But it's not like there was, from when I was there and could remember, a lot of places to sit and rest, or even any programming. So my understanding is now that the library is open, folks can still access. Now they can access the computers again, as well as, be in a space that is open. And that was something that the library wanted. They wanted to make sure that as they were closing, that service to people experiencing homelessness was not forgotten. So they were very much a part of that conversation. And like I said, the county stepped up and paid for the security guard so that Nehemiah could do that.
That's great.
But I don't think it was intended as like a warming or like a day center activity. It was really just to have access to the things that they were not going to have with the library being closed.
Right. And the senior center is
open. That's not correct, Jana, because when I approached Dr. Davis about that was one of the things that I specifically asked when we did the walkthrough, was so that they could have just a space and a place to come through. And that's why Drew did the walkthrough with us, but it wasn't for the laptop series. It was because we needed a place for our homeless to go. And when I approached Dr. Davis, that was the reason I approached him. And that was why that was done. It developed into other things as time went on, but when we initially had the conversation, it was for the fact that our community needed somewhere to go.
Okay. Thank you.
When I used to volunteer there, right before COVID came, I volunteered there with the organization called Triangle Empowerment Center, and we provided lunch for them. And there were several people that came on a daily basis. Yes, sometimes they came in there and just sat at the table just to get out.
Rita, you
Find
muted.
somewhere. Okay, excuse me. If we could find somewhere for them to go, you know, it would be greatly appreciated, because I know that was something that I enjoyed doing. And it was something that was much needed there. They were regular people that came, and they left at the times that when they weren't feeding there, they left at the times when the shelter was feeding. So, I mean, if we can get other organizations to come in there and provide services on a volunteer basis, nothing drawn out long, but to give them activities and stuff to do, I think that would help a lot also.
Thank you. I think that we definitely are going to continue that conversation. I know that, as Carolyn has mentioned, it's something that they're talking about, and it's definitely something that we're all aware of. So we will definitely continue that conversation. Perhaps and our executive meeting is coming up within a week after, well, just over a week. So we could probably talk about that then and decide how we can move forward with that. So thank you very much for that conversation, for the information about white flag planning. Our next item on the agenda is just announcements. I'm going to go ahead and just start with our flu vaccines again. We have been we've done not quite 100 flu vaccines for our homeless and uninsured, underinsured folks. So we're still looking for opportunities. We're going to be going back to Durham Rescue Mission on November 8th. We're going to be working with the NC Harm Reduction Coalition on November 3rd. But there's, we're still looking for other opportunities. So please let us know if you need, we have up to 200 vaccines available. So we still have plenty available to pass out. Are there any additional announcements before we close?
I would like to give two little pieces of information, if I may. One is that there has been a shower trailer coming to Trinity on Tuesday mornings during our free store, and we've been giving a lot of showers. It's partnership with the Wilsons, and their name of their trailer is Fresh Start, and they're supplying everything and a wonderful attitude and fellowship with the folks, and it's really working out beautifully. They get clean bodies to put in their clean clothes, so it works well. The other is I want to let everybody know that has not, check out our website. We've got a fundraiser in a week from Saturday called Walk in Their Shoes, and we'd love to have you all participate.
Thank you, Carolyn.
It's opentableministry.org. It's on there.
Well, it is 4:30 and it is time for us to adjourn. Our next HSAC meeting is November 17th. Keep in mind that is not the fourth Wednesday, that is the third Wednesday. This because of Thanksgiving. So be sure to join us then. And we are officially, I'll take a motion to adjourn.
I move that we adjourn this meeting.
And a second. Or if he wants to stay.
A second.
Thank you. That was Rita and Shay. So we are officially adjourned. Enjoy the rest of your day and the rest of your week.
Bye, guys.